I know this works because I did have open heart surgery. I had my aortic valve replaced last August for the second time. The first time I had it replaced 18 years ago. I am 56 years old, and I told my surgeon what I was doing. I prepared 3 days before my surgery with major autohemotherapy, which is ozone in the blood. I underwent the surgery. I was stepping out of the hospital about 4 days later. They discharged me. You're going to see we're on the verge of a new age in healthcare where people may not have the faith they had in traditional medicine. Traditional medicine still works, it's still good. However, the educational system in medicine is ignoring holistic health. This channel will be able to help people worldwide, especially in America. Welcome. I'm glad you're here. Thank you for taking the time to listen to this important information regarding potentially the future of your healthcare. My name is Adrian Escontrias. I'm a practicing anesthesiologist here in El Paso, Texas, and I've been doing this for over 20 years. I'm a graduate of UT Southwestern Medical School and trained at Parkland in anesthesiology and pain management. Since 2016, I've practiced interventional pain management exclusively. And it was during that time that I discovered medical ozone therapy. And two of my patients brought this information to me after I noticed how well they've been doing with their opioid therapy. I was consistently decreasing the amount of opioids I prescribed to them on a monthly basis. And one of them even was able to avoid having a right shoulder replacement surgery because of alternative therapies, including ozone therapy. Well, let's begin. Last year, according to the government, there was close to 80,000 opioid-related deaths in this country. Once again, I treated pain utilizing opioids, both in the operating room and as a pain management specialist, with ozone in combination with narcotics, and that's pretty much the standard of care. However, as we all know, this is the source of a medical epidemic within our country. And wow, wouldn't it be great if there was a possible alternative to just opioids in order to control issues such as low back pain, herniated discs, fibromyalgia, shoulder pain, etc. Well, this is what we'll be talking about. So back in 2021, I did start using medical ozone therapy, which is a therapy that's practiced regularly in Latin America as well as Europe. Most of the studies have been conducted overseas. Very few studies have been conducted in our country. After taking the appropriate training and reading the research, I've incorporated medical ozone therapy into my practice and labeled it kind of as a opioid-free pain management, which is it's unheard of at this time. Once again, I am an anesthesiologist, physician, trained in Dallas at UT Southwestern, and I've been working for 21 years, providing pain relief to patients. I'm not a wellness coach, and I'm not a guru. I just discovered the potential benefits of this alternative therapy in ozone that can help my patients. Actually, it can help all of humanity. Here at O3 Complementary Health, I do not replace the physicians you already see. I simply complement their efforts. I can complement the orthopedic surgeon, the general surgeon, the pain management specialist. Ozone therapy is essentially a great addition to whatever therapy you already take. Ozone therapy will never replace the treatments that you are already being prescribed. Even chemotherapy, radiation therapy, surgery. What ozone may help with is your your preparation before surgery and your recovery after any surgery. Now, ozone myths. Medical ozone is derived from medical grade oxygen, the same kind of oxygen in oxygen tanks, and that's in your hospital. It's run through a generator in precise amounts, and this is the gas that's a mixture of oxygen and ozone that is introduced into your soft tissues or into your blood. Never directly into the blood, but into an IV bag that has your blood in it. And this is how we introduce the ozone into your blood. And then this diluted blood of yours is then retransfused into your body. Ozone is never breathed directly into your body. It does harm the lungs. It's a very potent oxidant. But this is how ozone works. The oxidant ability of this gas lends to the hormetic effect, Hormetic, a hormetic effect, which is a small stress into your system, which then mobilizes your antioxidant enzymes to become functional and to wake up and fight inflammation, potentially disease, and to prepare your body for any stressors that you might have scheduled, like major surgery. Once again, this can be thought of as exercise for your cells. The ozone works on your mitochondrial organelle, your mitochondria in all of your body. Considering we have trillions of cells in our body, there are more than that many mitochondria in your body. The greatest concentration of mitochondria is in your brain and your heart. Thus, the extreme beneficial effects that we might see with consistent ozone therapy. Well, people would ask, if this works, why hasn't my own doctor recommended it? Why has he not even mentioned it? Well, your physician works in mainstream medicine, which is fair. In our country, ozone therapy is alternative medicine. It's complementary medicine. It's not even regulated. It's not on any insurance benefit. It's not under any insurance companies don't provide a benefit for this service at all. However, in Europe, it is mainstream. In Spain, there's at least 23 public hospitals that have practiced it since 2021. Germany, Russia, and even Cuba, they do have decades of experience with this therapy. Just because you haven't heard of it or your medical professional hasn't heard of it doesn't make it fringe. This is actually mainstream in the rest of the world. There are various standards, such as the ISCO3, the WFOT, which is the Madrid Declaration. These international bodies, they publish clinical standards governing the safety parameters by which medical ozone is practiced. It's not a question of legitimacy. It's a question of training and geography. American medical schools simply don't cover this. That's simply a gap in our system, and not a knock on your doctor or our current medical system. Okay, research. Simply for low back pain and disc disease. In 2024, a meta-analysis found ozone injections did outperform steroid injections at 6 months post-treatment. Another study that lasted 2 years of over 300 patients found ozone to have greater and more durable relief than steroids, with patients needing fewer medications, including opioids. That's the whole point of this, is to reduce our opioid use. Your knee osteoarthritis. For joint pain, a 2024 review in Frontiers in Physiology did find that ozone reduces inflammation and oxidative stress in knee osteoarthritis through cellular mechanisms similar to exercise. Now, the point I care about most are the opioids and opioid use. A 1-year trial of oxygen ozone injection for herniated discs, where ozone was injected directly into the discs, found significantly decreased opioid use with no adverse effects at 12 months. A 2019 review in Current Pain and Headache Reports framed ozone as a real alternative in America's opioid crisis. This sounds good to me, and this is why I pivoted my practice to more holistic healthcare, including ozone. Okay, what ozone is not. It's not a cure, and not a miracle, and not a replacement. You will not stop your current treatment. It does not work for everyone at every time. Anyone who promises a miracle, you should walk away from. What this means is this: there is real research that can reduce pain and reduce reliance on opioids for the right patient. This is worth consideration and worth a conversation between you, your physician, and possibly your local ozone therapist. Once again, we're talking about sick people, but healthy people can benefit from this therapy as well. The same mechanism that calms inflammation and supports mitochondria is what helps you bounce back from hard training. This is terrific for any athlete, any weekend warrior, or MMA fighters that whom I happen to take care of as well. On this note, if you are scheduled for any major surgery, like a knee replacement or abdominal surgery, really any surgery, my belief is that if you treat yourself with ozone therapy 3 days before the procedure, your chances of a quicker recovery, less chance of operative infection, and less pain. Well, those chances increase greatly. I will be researching actual studies that frame this, and I'll be making it available later. As an aside, I know this works because I did have open heart surgery. I had my aortic valve replaced last August for the second time. The first time I had it replaced 18 years ago with a tissue valve. This time around, well, I had a metal valve placed in there because the tissue valve wore out. I am 56 years old, and I told my surgeon what I was doing. I prepared 3 days before my surgery with major autohemotherapy, which is ozone in the blood. My mitochondria were optimized. My oxygen utilization capacity was optimized. I underwent the surgery. I wouldn't recommend it. It still hurt, but I was stepping out of the hospital about 4 days later. They discharged me, and yeah, I had this done at the Heart Hospital in San Antonio. I've been recovering well since then. It's still been a gradual recovery, but utilizing my ozone therapy, I felt pretty good. And as an aside, I've gone back to jujitsu and grappling like I was before. I've been doing that for about 26 years. It's part of my life, so I went back to it, and so far so good. I've gotten my heart rate over 160, and for a 56-year-old, that's pretty good. And my new valve has held up great. My cardiovascular system has held up great. So yes, this is not a study, but this is an anecdotal report. Okay, so my little practice is called O3 Complementary Health. Once again, we complement other medical techniques, we don't replace them. So on this channel, I'll be returning, giving information in plain English, tackling myths, and backing it with research papers. Leave your questions in the comments. In the future, we'll talk about the Wolf Protocol, WOLFF. This is a protocol that has been seen to help multi-level disc herniations with sciatica, treated with a combination of ozone and another alternative therapy, which I will get into later. Okay, thank you very much, and I really hope to see you in the future.